Different sets of cameras, don't cross. This one will take a photo and the other one with full Okay, there we go. Right, good evening, everyone. I request that we all observe a moment of silence for prayer, for meditation, and for dedication. Right, please be seated. I welcome you all to this Cape Town admission ceremony of the Colleges of Medicine of South Africa. I'm Johan Fagan, and I'm the president of the CMSA. On the stage around me, I'm joined by senators, by academics of various colleges, our executive leadership, and our special guests. I wish to welcome the Western Cape Minister of Health, Dr. Mbombo, the chairperson of the National Assembly, the Portfolio Committee on Health, Dr. Jacobs, and the Dean of the Faculty of Health Sciences of the University of Stellenbosch, Professor Miller, the Dean of the University of Cape Town, Professor Green-Thompson, and the Head of Western Cape Department of Health, Dr. Kluter. I also wish to welcome the academic staff of the universities of the Western Cape, of Stellenbosch, of Cape Town, our senators and examiners, and of course our most special guests, our graduates and your families. A special word of welcome to Mrs. Priscilla Ogunbanjo, who's sitting in the front row. She's the wife of the late Professor O, as he was fondly known, who was a highly respected and a much loved vice president of the CMSA until his untimely death in 2019, and in whose honor the Nigerian Doctors Forum of South Africa, represented tonight by Dr. Ugwu and Dr. Abi, has created a new award for the top candidate in the College of Family Physicians. Over the past few years, the CMSA has evolved from being principally an examining body to seeking to fulfill its founding objectives that includes promoting the ethical standards, the professional conduct for the benefit of humanity, and promoting the honor of the medical and dental profession. This has included transformation of the CMSA, becoming involved with advocacy, building alliances with sister colleges, and creating an educational platform, and establishing a scientific journal. The recent leadership of the CMSA actively transformed this organization with a focus on gender and race of its leadership, making examinations fairer, making examinations and the admission ceremonies more accessible, and making, to quote our immediate past president, Professor Flavia Senkubuga, the CMSA a people's college. Some key transformation milestones in the past few years includes that Professor Flavia Senkubuga was elected the first black female president of the CMSA in 2019, that 66% of our senators are of color, 55% of our senators are female, and 29% of our colleges are now led by female presidents. Mrs. Yolokazi Kanzi was appointed the first black academic registrar of the CMSA. And for these transformation efforts, the CMSA was very proud to receive the Standard Bank Top Gender Empowered Company Award in 2022. To ensure inclusivity, the CMSA now has 8 examination centers around the country, has opened regional offices, and is holding admission ceremonies at 5 different centers to make it possible for candidates, for their families, and faculty to join the celebrations. And there's been a complete redesign of the CMSA examinations to ensure equity for candidates, and this has led to improved pass rates while adhering to international best practice and without compromising standards. In relation to advocacy, the CMSA has recently made public pronouncements about equitable vaccine access, about strengthening occupational health systems in the post-COVID-19 era, and about foreign recruitment of African healthcare workers. The CMSA is also a national body with representation of all the medical and dental specialties and has exceptional expertise among its membership. I therefore believe it's critical that our government should include the CMSA when deliberating about the shape and the future of our healthcare. The CMSA is also forging alliances with sister colleges, especially in lower and middle income countries, as we have similar challenges around training and healthcare, but also to finding solutions to such challenges. The CMSA recently attended a joint meeting with the College of Physicians and Surgeons of Pakistan. It's also establishing an alliance of surgical colleges of Africa with the West African College of Surgeons and the College of Surgeons of East, Central, and Southern Africa that jointly will represent 37 countries in sub-Saharan Africa, and hence will speak with a powerful, so unified voice to advance surgical education and training in Africa. The CMSA also recently convened the International Medical Education Leaders Forum that brought together senior leadership from Africa, from Pakistan, and from Canada. From an educational perspective, the CMSA is collaborating with our universities to establish an online educational platform for our candidates, and is also rolling out our diplomas to the rest of Africa to improve healthcare on our continent. The CMSA is also establishing its own high-quality, peer-reviewed medical and dental scientific journal to provide an opportunity for you to publish your MA dissertations and other research. Now, the cost to authors to publish research is becoming really expensive and discriminates against authors who cannot afford article processing charges. So the CMSA is establishing a journal fund to assist authors who are not financially supported by the institutions to ensure that the ability to pay is never a barrier to sharing research. For the CMSA, this is an important matter of social justice. But tonight we gathered here not to talk about the CMSA, but to celebrate the successful conclusion of your diploma, your specialist and your subspecialist training. As you are joined by your family, your friends and your colleagues, it's time to reflect on your specialization journey and the sacrifices made through working long hours and studying late into the night and over weekends. However, I'm confident that every sacrifice you have made will be worth it. So enjoy this evening, and may your loved ones also enjoy celebrating the special moment with you, because without their support, none of what you've achieved would have been possible. Tonight we also celebrate your teachers, our universities and our teaching hospitals for giving you the opportunity to acquire your specialized knowledge and skills. We also acknowledge the CMSA for presenting an examination platform for our universities to examine their candidates to ensure that they can safely enter specialized practice. And we also acknowledge the incredible voluntary commitment of elected CMSA leadership, the board, our senators, our college presidents, our council members, and of course all our examiners. And finally, I wish to also say a special thank you to our CMSA staff, and especially to our CEO, Professor Eric Buch, our Executive Director for Education and Assessment, Professor Vanessa Birch, and our Academic Registrar, Ms. Yolokazi Kanzi. I now have the privilege and pleasure of introducing our invited speaker this evening, Professor Elmi Miller. Professor Miller was appointed the first female dean of the Faculty of Health Sciences at the University of Stellenbosch in 2022. She was formerly head of general surgery and of the Department of Surgery at the University of Cape Town, and she's an internationally celebrated clinician, scientist, and leader in kidney and liver transplant surgery, and holds an A1 NRF research rating. She pioneered and established the first transplantation program in the world to use HIV-positive donors for HIV-positive recipients. And her persistence with this initiative in the face of stiff opposition was recognized in a tribute in The Lancet entitled Elmi Miller, Bending Rules, Changing Guidelines, and Making History. She has received numerous awards for her work, including the College of Fellows Research Award of the University of Cape Town, the Checkers ShopRite Women of the Year Award, and the Women in Transplant Hero Award of the Transplantation Society. And for me, what's perhaps most special is that she received the Alan Pfeiffer Research Award that honors a UCT researcher whose outreach work has contributed to the advancement and the welfare of South Africa's disadvantaged people. So with her bold and visionary leadership style, which we've got to know, we look forward to her taking academic medicine at the University of Stellenbosch and in South Africa in general to new heights of excellence during her tenure as Dean. Professor Miller, may I ask you to come and give your address?
A few weeks ago, a patient came to see me. He received a transplant from his sister in 2017, and this kidney failed in 2022. I did the transplant. He told me that his graft never really functioned properly, and according to him, this was the most likely reason that I did his surgery in 2017. He was now coming for a second transplant, a kidney donated by his wife. He was meeting me to tell me that he doesn't want me to be involved in his transplant, although he was worked up for this procedure by people in my practice and my team. A few months ago, I transplanted a patient with a kidney from a friend. The day after the transplant, the patient developed a very low blood pressure, and a few hours later, the patient died. We were not sure what happened, if he had a myocardial infarction, he had underlying sepsis, or whether he was bleeding. Whatever happened, the outcome was dismal. Why am I telling you these stories of failure and difficulty on an evening where you want to celebrate your new qualifications and your success? The answer is that failure explicates. In other words, failure makes us analyze our life events in more detail. The German philosopher Peter Sloterdijk writes in the third volume of his monumental project to chart Western thought, entitled Foams, about how the process of explication has driven Western science in the modern era. He writes, "The present age does not turn things, conditions, or themes over. It rolls them out. It unfolds them. It pulls them forwards. It lays them flat and takes them apart. It coerces them into manifestation. It respells them analytically and incorporates them into synthetic routines. It turns suppositions into operations. It supplies muddled expressive tensions with exact methods. It translates dreams into instruction manuals. It wants to know everything about all things in the background, folded inwards, previously unavailable and withdrawn enough at least to make it available for new foreground actions, unfolding and splitting interventions and remoldings. It translates the monstrous into the commonplace. Understanding the world is for Sloterdijk a process of explication, and each of us can think of how explication functions in our respective clinical fields of reference. Rolling out, turning over, laying flat and taking apart, coercing into manifestation, scrutinizing analytically, formalizing into our routines, developing methods, bringing the murmuring background of the body into the foreground, intervening and remolding, making the wondrous fact of life commonplace, slaying the monster of ignorance. Tonight I want to apply this process of explication not to the scientific endeavor, but to the inner world in which all of us harbor within us. In a way, I want to focus on that phrase of Sloterdijk's when he writes, "It translates dreams into instruction manuals." And I want you to think about this with me, about the dreams that come through our failure and the instruction manual that can be fashioned from it. As a surgeon, when I walk into theater, my procedure is built on a foundation of work done by other people. My patient comes from dialysis, worked up by a physician. His immune suppression is planned based on immunology reports and tissue typing done by a team of experts with multiple people participating in this decision-making process. All our paperwork and workup is done by the nurse coordinators and social workers, and the day before the operation by the nurses who work in the ward. CT scans map out the anatomy of the vessels, and this is reported by radiologists who understand what exactly it is that I need to know before I can remove a donor kidney. And when the patient arrives in theater, it is the anesthetist who makes sure that this patient is safe and ready for the operation. All patients will die of sepsis if theater instruments are not handled correctly and sterile by the theater nurses. And post-op, we usually have a critical care team with doctors and nurses attending to our patients. So before I make my first incision, and after I've made the last closing stitch in a continuum of time preceding my technical intervention and continuing it after it, I operate not with my hands, but with trust. If I cannot trust the pre-operative workup, the social worker, the psychologist report that the patient is fit and ready for the transplant, the physician assessment and the lab that does the tissue typing, it is a fact that the patient will have a poor outcome. Similarly, I need to trust the anesthetist and the critical care team to look after the patient intra and post-op. My part in the patient's care is relatively small. And all these complex interactions are underpinned by a common understanding of trust. This is the first level of trust we need in our day-to-day clinical practice. But there is a next layer of trust that is just as important in the day-to-day running of a successful practice. The trust we need between ourselves and our patients. When I started the HIV positive to positive transplant program at Groote Schuur in 2008, we were not sure whether the outcomes of these marginal kidneys that were used for transplantation would work well. We were not sure if the second viral strain would flare up and cause rampant HIV. And in the world, there was no experience. HIV positive patients had little choice in South Africa. Dialysis was not available to them, and they needed renal replacement therapy. I presented them with an option that was unsure and were perceived by some medical experts as dangerous at the time. However, from the beginning, I was truthful about the fact that I did not know exactly what the outcomes of these kidneys would be. And from that truthfulness, I built relationships with these patients that resulted in trust. To a certain extent, it was trust they had in me and the treatment modality I put on the table, but more importantly, I also needed to trust them, to understand and accept the consequences of their own decision. Patients are subjects with whom we have reciprocal trust relationships, not objects on which we apply scientific and technical solutions. Patients need to trust us, and we need to trust them. In the case of the patient who died after his transplant, we had a strong relationship of trust between me and him and between me and his family. But I could also rely on my team to help me in this situation. I did not have to face this problem alone. I had the coordinator, social worker, several nurses, our physician and ICU doctor next to me when I talked to his family. And all this helped me, as well as the family, to get through a very difficult time. So what happens when trust is missing? If a patient comes to us challenging our skills and our decision-making and our abilities, like the patient I described in the beginning, the trust in this relationship is broken, and it's best to acknowledge this up front, even if it is very difficult. I cannot operate on this patient, and he can never trust me. When I became a surgeon, the role models in my world were mostly men. They were strong, they never cried, they worked long shifts and boasted about their results. They never talked about their feelings or how vulnerable they felt when things went wrong. They were focused on factual and scientific conversations. Tonight, up to this point, you were mostly focused on your exams, on recognizing X-ray pictures and blood results and work out the details of the newest evidence in the New England Journal of Medicine and other high-impact journals. To pass your exam, you needed to be obsessed with statistics and numbers needed to treat an evidence-based medicine. Tonight, I want to encourage you, in Sloterdijk's words, to unfold and open the issue of trust. As humans, we are extremely vulnerable, not only as a GP, a nurse, or a specialist, but also in our families and between our friends. And if we don't address and understand our own vulnerability, there is the risk that we become hard and unreasonable and potentially emotionally unwell and even sick. Medical doctors have some of the highest suicide numbers in the population. We also have high numbers of people who are drug and alcohol dependent. Let's be honest. We are not really that hardcore and strong as our teachers and mentors pretended to be 20 or 30 years ago when we trained. We are extremely vulnerable, and vulnerability is best addressed in the context of trust. I emphasize the importance of the team in the workup of the patient, but there is another reason why we need this team. We need each other to help us get through our days when dealing with sick and emotional patients. Relying on ourselves only in these situations can be very difficult. Therefore, we need to kindle the relationships we have with our colleagues. Medicine is best practiced in a team, and it's best practiced in a team where you trust each other. Even in the most lonely private practice, you will still rely on the people in your team, the nurses, the physios, the OTs, to help you deal with complex clinical and emotional problems. When we have difficult clinical outcomes, like my patient who died after a transplant, there is a need to be able to rely on your team. So I think it is important to value your team. Explain to your team how much you need them in good times and in bad times. We might think this person is just an assistant or a nurse who helped to do a small part of a big procedure. However, it is when things go wrong that we often realize the enormous value this team had in the management of the patient and the family. The truth for me is that I would never have been able to handle a patient who died if it was not for this extensive team of colleagues who I could trust and who could help me in a situation where I personally felt extremely vulnerable. But when I had a patient question my abilities, told me I'm not good enough for him, asked for a different surgeon, I also needed someone who understands this type of patient behavior to help me think this through. So I phoned a friend that I trust and who also deal with patients regularly, and I talked the situation through with him. That meant I could get a perspective on this problem and realize that I have to turn this patient away. Perhaps it sounds like a small thing in the context of my day-to-day work and practice, but the conversation with this patient left me feeling vulnerable and lonely. I want to ask tonight, is our unaddressed vulnerability the thing that drives long-term mental health and wellness problems in our profession? When I was a registrar, Prof Dent was in the surgery team at UCT, and whenever we presented a case or a talk, he would always ask, so what is the take-home message? So I'm asking, what is the take-home message for the people sitting in the audience tonight? What do I want you to remember when you walk out of this room? As specialists, we are leading many of the healthcare initiatives in South Africa. We can do this best if we are honest about our vulnerability and acknowledge and nurture our teams and colleagues to build professional communities of trust. What healthcare needs in South Africa more than anything else at this moment is compassion for ourselves, for our patients, and for our common humanity. This is my first take-home message. Never be arrogant. You can and should be confident in yourself, in your decisions and in your actions, but be aware of your own vulnerability. One day, you will be a patient too. One day, you will make a mistake. And one day, you will do everything right, but the patient will still have a bad outcome. Acknowledging your own vulnerability will mean that you will also be kinder with the vulnerability of your colleagues. Mental health and well-being is an important topic in the corporate, healthcare, and university environment today. Many programs are put into place to look after staff well-being in many different environments. You are sitting in this audience tonight as colleagues and as friends. I still remember who was sitting in the audience with me when I got my FCS diploma in 2004, my fellow vulnerables who I trust. It is your shared responsibility to look after each other before you look after the patients who will depend on you, and then to go out and care for patients and the vulnerable and sick people who trust you with their lives. You can only do so, and this is my last take-home message, if you also share with these patients our common humanity.
Professor Miller, but thank you for a wonderful, wonderful presentation. I'm going to ask our immediate past president, Flawe Senkebuge, to give you a gift of thanks from the Colleges of Medicine. Right, we will now proceed with the presentation of the medals to our distinguished candidates and the admission of our new fellows by peer review, our diplomates and our fellows and our certificates by examination. So thank you very much. Flawe, can you give me a hand?
Mr. President, I present to you candidates who are recipients of medals for achieving outstanding results in the respective examinations. The Hemi Samson Medal from the College of Anesthetists of South Africa, Part 1, Dr. Wynand van Wyk. The Peter Gordon Smith Medal and Book Prize from the College of Dermatologists of South Africa, Part 1, Dr. Rifain Tandanani Bofu. Campbell McFarlane Memorial Medal from the College of Emergency Medicine of South Africa, Part 1, Dr. Asha Vijay Dana. Sorry, I think he is also from the College of Dermatologists. Now, from the Fellowship of the College of Dermatologists of South Africa, the Campbell the Peter Gordon Smith Medal and Book Prize from the College of Dermatologists of South Africa, Part 1, Dr. Nicola N. Gray. The Campbell McFarlane Memorial Medal from the College of Emergency Medicine of South Africa, Part 1, Dr. Nebo Ndebele. The Tim Quain Medal from the Fellowship of the College of Family Physicians of South Africa, Final, Part A, Dr. Hayden Leslie Poulter. The Therensen Naidu Medal from the Fellowship of the College for Pathology, South Africa, Part 2, Dr. Anes Awath Behar. The Justin Van Sal Medal from the Fellowship of College of Ophthalmologists of South Africa, Part 2, Dr. Leandre Linde. The J.M. Edelstein Medal from the Fellowship of the College of Orthopedics of South Africa, Final, Dr. Kayem Paul Kutsie. The Robert McDonald Medal, Fellowship of the College of Pediatricians of South Africa, Part 1, Dr. Ashley Tyler Sant. The Robert McDonald Medal from the Fellowship of the College of Pediatricians of South Africa, Part 2, Dr. Bradley Brown. Also for the same Robert McDonald Medal, Fellowship of the College of Pediatricians of South Africa, Part 2, Dr. Sereni Murugasan. The A.M. Mayers Medal, Fellowship of the College of Physicians of South Africa, Part 1, Dr. Jennifer Kate van Heerden. The Ashadab Medal from the Fellowship of the College of Physicians of South Africa, Part 2, Dr. Sophie Angerat Davis van Es. The Samson Medal, Fellowship of the College of Pharmacologists of South Africa, Occupational Medicine, Part 2, Dr. Zahida Sonde. Fellowship of the College of Radiologists, the A.M. Mayers Medal, Dr. Derek Basson. The SASCRO Medal, Fellowship of the College of Radiation Oncologists of South Africa, Part 1, Dr. Nicole Jane Takon. The Lionel B. Goldsmith Medal, Fellowship of the College of Urologists of South Africa, Final, Dr. Alexander Jacek Spitko. The Sasa John Cooper Medal, DA, South Africa, Dr. Nina Z. Karelse. Mr. President, I present to you candidate for the admission of a fellow by peer review, Professor Regan Shane Solomons from the College of Pediatricians. Mr. President, I present the following successful candidates for admission to the Higher Diploma in Family Medicine of the College of Family Physicians of South Africa. Didon Muteba Kalonji. Diploma in Allergology of the College of Family Physicians of South Africa, Shona Ann Emmanuel. Diploma in Anesthetics of the College of Anesthetists of South Africa, Kumiso Yada Davids. Joseph Benedict Etonu. Auxilia Dinotenda Govore. Siamtanda Luana. Lemshe Edward Mantata. Mwanamatiba Mante Tibi Mulebe. Shinen Stein. Mason Tanju. Diploma in Child Health of the College of Pediatricians of South Africa. Nazrin Akou. Lee N. Klassen. Sisanda Tlakia. Abigail Rose Hobbs. Melissa Karen Kerspuy. To be wooded by the husband, Dr. XSM Baloi, Petoho Evelyn Katla. Gele Kholwane. Matthew John Kukemur. Brownwen Moses. Tabile Happiness Nduli. Dylan Craig Roberts. Elinza van Straten. Diploma in Forensic Medicine for the College of Forensic Pathologists of South Africa, Pathology. Magdal Smith. Suzanne van der Merwe. DCH of South Africa, Lungile Sangwe. Diploma in HIV Management of the College of Family Physicians of South Africa, Tahira Davids. Prasna Dilraj. Fernanda Edwards. Cindy France. Kristen Lucy Jacobs. Fatima Khan. Kele Kholwane. Farron Chanel Clinsmith. Melissa Gube. Sinombongo Macekiswayo. Mundende Ives Mafulu. Dinotenda Florence Mangozo. Danielle Menges. Marisa Mary. Wandile Mhlongo. Ntsiki Nora Muhole. Kinda Grace Ngwei. Nedima Ruth Ijioma Nkado. Caroline Padaraf. Shoen Patha. Laila Raycliffe. Carlota Mpho Sekhokwani. Tamrin N. Smith. Janine Lee Tromp. Juhi Tulsi. Tamili Fantoner. Diploma in Internal Medicine of the College of Physicians of South Africa, Neil Adams. Lindelani Experience Mabaso. Diploma in Mental Health of the College of Psychiatrists of South Africa, Taryn Simone Ackerberg. Kim Tami Biga. Cindy Rose Pretorius. Segunet Strauss. Diploma in Obstetrics of the College of Obstetricians and Gynecologists of South Africa, Nicole Ashley McLean. Matabo Tuto Makhel. Nobulali Maneli. Odiel Joylyn Patha. Fifi Skarana Kakura Chitemisa. Nabila Tofar. Janek van Beek. Diploma in Ophthalmology of the College of Ophthalmologists of South Africa, Zakaria Alashar. Lauren Caitlin Dominique Lolun. Diploma in Primary Emergency Care of the College of Emergency Medicine of South Africa, Christopher James Bell. Johannes Pretorius Dutoit. Rukwaya Gabir. David Louis Bennett Goldschak. Parnav Hari Persat. Danai Lloyd Nhlanga. Ncebo Ndebele. Angelique Antoinette Remley. John Sorensen. Zizo Yose. Mr. President, I present the following successful candidates for admission to the Fellowship of the College of Anesthetists of South Africa. Radi Al-Zaruk M. Al-Senosi. Dinel Behari. Lori Dipenar. Dineo Bontle Hamilton. To be hooded by the husband, Dr. A.J. Spitsko, Megan Kate Harvey. Faida Hendricks. Mariam Isaacs. Ruth Janely Lind. Laura Jane Logie. Theodi Rene Lombard. Willem Andries Ninebeyer Low. Utsudi Joe Malumalu. Karis Polani Matthews. Juanita Blomeki Naube. Tamuka Franklin Chitonga Ndlovu. Colette Nisling. Zibele Nibe. Jane Louise Orok. Scott Andrew Pierpoint. Willem Abraham Prinsloo Ras. Alison Claudette Sally. Andries Petras Swart. Tebogo Mokotong Mosekama Tabane. Anele Shadrik Sambu. Anya Wium. Matthew Jeremiah Sitanda Young. Fellowship of the College of Cardiothoracic Surgeons of South Africa, Yin Yong Kim. Sashalin Naidu. Nicholas van Zyl. Fellowship of the College of Dentistry of South Africa, Prosthodontics, Jennifer Julian. Nicola, Fellowship of the College of Dermatologists, Part 2, Nicola N. Gregg. Josiah Tatenda Masuka. Samina Parkar. Eddie Mhlava Zita. Fellowship of the College of Clinical Pharmacologists of South Africa, Refame Tandanani Mpofu. Fellowship of the College of Emergency Medicine of South Africa, Quadentia Florence Dosa. Cornel Dun. Raisa Goga. Mary Elizabeth Hofe. Kidiboni Mbanga. Kebi Fiona Meyer. Lynn Swartz. Francois Isaac Low Fori. Fellowship of the College of Family Physicians of South Africa, Final Part B, Randall Shane Ortel. Hayden Leslie Poulter. Fellowship of the College of Forensic Pathologists of South Africa, Anez Awath Behari. Tracy Lynn Cook. Sean Jacobs. Anna Maria Reeve. Fellowship of the College of Maxillofacial and Oral Surgeons of South Africa, Kim Pedro Biech. Fellowship of the College of Neurologists of South Africa, Lineshri Naimeka. Avumile Nongoko. Themba Bekani Shabalala. Fellowship of the College of Neurosurgeons of South Africa, Byron Gordon Dijon. Toivo Usko N. Hashila. Manyando Lubasi. Fellowship of the College of Obstetricians and Gynecologists of South Africa, Asma Ahmed E. Alkawak. Kaylin Pia Apollos. Tsulufelo Bilwane. Rory Britt Fortin. Tasneem Gallant. Andrew Franklin Gora. To be hooded by her husband, Dr. J. Mufenda, Justine Nalimanguluke, or Nalimanguluke, Indongo. Kashifa Jafta. Mobin Jumarti. Mano Pea Hafo Kambunga. Joanne Desiree Kamis. Ndaluza Masie. Richard Mupombwa. Helena Muningenawa Nashandi. Victor Olurotimi Adi Olujobi. Senzekile Shazi. Ilona Ndapewa Shihama. Donier van Rooyen. Donier. Part 2 of the Fellowship of the College of Ophthalmologists of South Africa, Claire Francis Kennedy. Zakia Bibi Mohamed Kasim Limalia Esop. Leandri Linde. Yolande Marina Teron. Alton Yvin Thomas. Elizabeth Katharina van Eck. Fellowship of the College of Orthopedic Surgeons of South Africa, Ashley Thompson Arakal. Delroy Arnolds. Goat Deng Ding Ayik. Benjamin Heyfron Blankson. Caleb Paul Gauthier. Mohamed Salem Daoub. Jan Petras Gray. Bayanda Bupelo Ndindwa. Donovan Stephen Willemse. Fellowship of the College of Otorhinolaryngologists of South Africa, Charles Moyo. Abdiwahab Adrihaman Mukhtar. Joshua Michael West. Fellowship of the College of Pediatricians of South Africa, Mish Al-Bardey. Larissa Baka. Siyabulela Nkosazana Povula. Muhammad Asrafi Jamil Buzgith. Cordelia Susan Elizabeth Eli. Stacy Lee Alette Jenkins. Rizka Johar. Raja Tohafifwa Kauluma. Yolanda Vuyokazi Makangala. Bradley Brower. Mpho Melinko Makwarene. To be hooded by Dr. A.J. Daniels, Nosipiwe Mandla. Serene Muragasan. Nobi Jabulo Mumalo. Mishka Peterson. Muhammad Sali. Audrey Sullivan. Karin van der Merwe. Fellowship of the College of Pediatric Surgeons of South Africa, Andrea Kass. akhona mbonisweni. Kutlo go sego motlhobogwa. Fellowship of the College of Pathologists of South Africa, Anatomical, Janet Lindsay Distandler. Rufaro Diana Jaravaza. Angela Katleho Tamang Mautu Mukot. Yolandi N. Murray. To be hooded by husband, Dr. G. Filyun, Nandi Filyun. Fellowship of the College of Pathologists of South Africa, Chemical, Janine Martins, to be hooded by Prof Pillay. Fellowship of the College of Pathologists of South Africa, Hematology, Ethan James Cantana. Robert Kingsley Lolun. Girisha Panchu. Fellowship of the College of Pathologists of South Africa, Microbiology, Shun Yat Chu. Dawood Da Costa. Amanda Julia Overmeyer. Fellowship of the College of Physicians of South Africa, Alexandra Buckley. Sophie Anghart Davis van Es. Henry Jacobs. Jessica Kapinaru Kachomus. Simon Jack Leroux. Scott Gareth Lee Jones. Ndumbwe Paul Mabobo. Mahlatsi Mankhele. Malcolm Masikati. Obi Mawire. Patrick J.R. Mpesi. Noshin Parker. Tolakele Sabela. Prabhash Sadai. Shahid Salim Sorathia. Mohammed Yassin Sunge. Simon Hans Fienstra. Fellowship of the College of Plastic Surgeons of South Africa, Jonathan Kuri. Fellowship of the College of Psychiatrists of South Africa, Akim Adedolapo. James Wulogbi Bega. Daniel Coutier. Giandri Komring. Fatima Dangor. Richard Paul Gontlavs. Deepika Haripersat. Betty Kadenge. Ilana Juliet Links. Abongile Makuluma. Tinashe Nigel Mangozo. Christian Pillay Mudapa. Kelebogile Refilwe Mary Sinoelo. Fellowship of the College of Public Health Medicine of South Africa, Occupational Medicine, Zahida Sonde. Fellowship of the College of Diagnostic Radiologists of South Africa, Emmanuel Kabaisa Banda. Anton Peter Dobel. Sipokazi Kazi. Jeanette Holzhausen. Beulah Christina Janse van Rensbeck. Nee van Sey. Juan William Janse van Rensbeck. Yiying Melissa Liu. Humphrey Mapuranga. Bruce Jobias Mupurwa. Yashkir Naidu. Aaron Ikaneng Ngamulani. Elsabi Jacoba Smith. Derek Jacobus Basol. Philippus Hendrik Zile. Fellowship of the College of Radiation Oncologists of South Africa, Marion Jean Alga. Fezana Hendricks. Akila Sirkute. Fellowship of the College of Surgeons of South Africa, Niha Awasti. Arlette Becker. Karin Boyce. Johannes Jacobus Petrus Beitendach. Pilani Mbuso Bungai. Ahmed Alia Diab. David Lawrence Ashwin Gori. Nazmi Karim. Mohammed Nawaz Karimbokos. Avin Kamajit. Franz Ropi Ndotora. Crystal N. Sonderson. Gilbert Teyangesikai. Fellowship of the College of Urologists of South Africa, Hileni Hamukoto. Pavin Kumar Patel. To be hooded by the wife, Dr. Havi, Alexandra Jackie Spitko. Mr. President, I present the following successful candidates for admission to the Certificate in Cardiology of the College of Physicians of South Africa. Tsungai Chipamwanga. Certificate in Cardiology of the South African College of Physicians, Ellis Tapiwa Gambaya. Zesizwe Ngubani. Dalitso Segula. Certificate in Clinical Hematology of the College of Physicians of South Africa, Kamuchirai Yukai Tanzimirwa. Certificate in Critical Care of the College of Emergency Medicine of South Africa, Victoria Sarah Stephen. Certificate in Gastroenterology of the College of Pediatricians of South Africa, Imet Elamroni Elashimi El Katiali. Lesego Ndlovu. Certificate in Gastroenterology of the College of Physicians of South Africa, Mzamo Ntsikelelo Mbele. Certificate in Gynecological Oncology of the College of Obstetricians and Gynecologists of South Africa, Mokwena Martins Muhosho. Certificate in Infectious Diseases of the College of Physicians of South Africa, Nectarios Sophocles Papavaranavas. Certificate in Maternal and Fetal Medicine of the College of Obstetricians and Gynecologists of South Africa, Sibusiso Good Enough Mhlapha. Certificate in Nephrology of the College of Physicians of South Africa, Butlenyana Augustina Lerotodi. Luvuyo Mzingeli. Subspecialty Certificate in Neuropsychiatry of the College of Psychiatrists of South Africa, Lihle Ngweba Bewana. Certificate in Pulmonology of the College of Pediatricians of South Africa, Zandiswa Noalaza. Certificate in Pulmonology of the College of Physicians of South Africa, Tariq Hassan Ahmed Zobair. Ntombenhle Phindile Gina. To be wooded by her husband, Dr. E.K. Dalwai, Certificate in Reproductive Medicine of the College of Obstetricians and Gynecologists of South Africa, Khatija Adwa. Certificate in Rheumatology of the College of Physicians of South Africa, Emma Cora Gardner. Rutendo Yvonne Rukarwa. Certificate in Urogynecology of the College of Obstetricians and Gynecologists of South Africa, Colin Yako Montgomery. For the first time, we're presenting the Gobia Adebola Ogunbanjo Medal, and hereby wish to ask Mrs. Ogunbanjo to ascend to the stage to present. Dr. Hayden Leslie Portier.
Right, thank you very much. That was quite a marathon, but well done. I'd now like to invite Dr. Kenneth Jacobs, who is the National Assembly Chairperson of the Portfolio Committee on Health, to congratulate all the diplomates and the fellows and certificates. Thank you very much.
Thank you, Professor Fagan and the Colleges of Medicine of South Africa for this invitation. It is a great honor for me. I am so excited to be tonight to see all these new people who have achieved so much this evening. And of course, I was able to, it was just coincidence, my daughter receiving a diploma on the same evening. So thank you very much for this great opportunity. To all of those who received your honors this evening, the sleepless nights are over, the pain is in the past, but the hard work now lies ahead of you. Your world has suddenly changed, and it has changed for the better. And then just to remind you that only one of your goals has been achieved. There's so many other goals which I'm sure you want to achieve and that you are going to achieve. And from here onwards, you're going to experience many good things in your specialty, in your work, with your family. Some of you are going to reach great heights academically and clinically, and even some financially. So congratulations to each and every one of you. Continue to keep the banner of the health sciences high. Always remember that learning is lifelong. What you have started is going to be for the rest of your life. Your hard work and achievement, yes, deserves a warm, thoughtful words of recognition and encouragement. I today read the document presented or published by PPS called The Professional. And there was the question that they asked, what do graduate professionals worry about? And the report indicates the following, that 31.9% say they have little stress. But it also means that more than 2/3 of us are quite stressed. And we've heard what the Dean of the Faculty of Health Sciences of University of Stellenbosch was saying about the stressfulness of our lives. So the world is a stressful place. So the question was asked, what are the greatest causes of stress in your life? And two things were quite personal, balancing home and work, job security, and the last one was unreliable electricity supply. The following question was, how are graduate professionals affected by their stress? And it was a very interesting answer. Emotionally and mentally, both ranged at 50%. Physically at 32.9%. On stress relieving mechanisms, the indications were that most use physical exercise, 55%, and finding a hobby, 32%. So I want to say to you, and you will see I have gray hair, been around quite long. In a nutshell, take care of yourselves, balance work and family, find a hobby, exercise regularly, protect yourself from emotional and mental exhaustion. Remember to enjoy life, to enjoy your work and your family, and congratulations again to all of you. Thank you.
Well, thank you, Dr. Jacobs. And we have a small gift for you. Professor Flywe Senkabuga, will you please give that to Dr. Jacobs? Yeah, next I'd like to ask Dr. Mbombo, the Minister of Health and Welfare, Wellness in the Western Cape, just to say a few words. I think we're very, very fortunate in the Western Cape to have a well-functioning health system, and that's just so key to training specialists. So please, Dr. Mbombo.
Thank you. I think the question for me is about whom shall we send? Who will go for us? In the health system, that will find that post-COVID is in the ICU. Who will go for us to go to the remote areas where you find that everything closes at 4 p.m. and then there are no health services? And who will go for us and go to the facilities where the patients are sleeping on the floor because there's still a long waiting period for the patients to be transferred? Professor Miller, Professor Green-Thompson, who will make sure that the list that takes about 3 years for the knee injuries, for the renal dialysis, for everything, who will be able to reduce that list? Whom shall we send? Now you are specialists, but unfortunately, unlike at the time that you were doing your undergraduate, you will have been expected that at least you'll be operating at that higher special level. Unfortunately, the system doesn't allow you to be able to do as much as you could. Because we're talking about the system that patient that you'll see finally is a patient that will have actually indirectly been referred by the community health worker in that informal settlement, who would have, when she or he was doing the household visits, and identify that there's a problem here and refer to the nearest mobile clinic, general professional nurse, and then was referred to a clinic by a professional nurse, and was referred to the district hospital, was seen by a ComServe or by the intern, and was referred to the MO, who referred to the tertiary or to the specialist. The point that I'm trying to make, whom shall we send to understand the trust, to understand the system? It needs all of you, because it's no longer about looking at that wound at the specialist, but now you are in a system that gets impacted by the other system. So you are the ones who will go for us, who will understand that the upstream factors, Professor Naledi, the upstream factors, the social determinants of health, the inequalities, the unemployment, everything that is outside our health system is what makes you sweat so much. And the parting shot is about health is political. That anti-SARA has to wait for 3 years for that knee injury. That you'll have in areas where there's a high level of poverty, there's a high level of violence, there's a high level of trauma where you have to go to theater for 9 hours trying to stop in terms of the stabbed heart. Meaning, the noises that some of you keep on coming to us and say that when are you going to increase more of the registrar's posts? When are you going to give us more staff? Don't be silent. Keep on doing it, because health is political. We'll never be able to do and give you the robotic surgery, in terms of for surgeries and everything. We'll never be able to give you extra stuff if you are silent. So raise that voice, because you are doing for the anti-SARAs, because we don't want to leave anyone behind. So you are the people who will go for us. So go there and make sure all the systems function. Don't forget that patient has been referred by a community health worker somewhere there. It's not your patient, it's the patient that belongs to everyone. Congratulations. Thank you very much.
Well, thank you, Dr. Mbombo, and I'm going to ask Flawe Senkebuga to give you a gift as well, and just in thanks from the CMSA. Thank you. Right, I also now have the pleasure of welcoming all our new graduates to our specialist community. This is indeed a time for great celebration, and I now give our graduates the opportunity to stand up, to make a big noise, and to acknowledge your family and your teachers. So please stand up and But my plea is for you all to remain in Africa, where your services are desperately needed. Practicing specialized medicine in low and middle income settings can be challenging and at times very frustrating, but it can be professionally highly rewarding. With less than 5% of patients in Africa having ready access to safe, affordable surgery, this is where you can have the biggest impact as an anesthetist or as a surgeon, and the same is true for all the specialist disciplines. I ask that you continue to read, to conduct research, to grow and to broaden your minds, and to share your knowledge and skills by remaining involved in teaching programs, even if it's as unpaid honorary consultants. I ask that you also support the CMSA, which is such an important national and international institution for specialized training and assessment, not only through your continued membership, but also through the Young Specialist Forum. The Young Specialist Forum presents an opportunity for young specialists like yourselves to mentor registrars, to develop online preparatory educational material for diploma and registrar candidates, and to serve as a bridge between the CMSA and the registrar community. And I ask that you take care of yourself and your loved ones, look after your physical and your mental well-being, be kind to yourself, take time out, and be present at important family events. And finally, I ask that in a country with so much inequality and poverty and hunger, that you always remain humble, you remain grounded, and you never lose your humanity. I now ask that we all stand to sing the national anthem. But by the power vested in me and on behalf of the Senate of the CMSA, I now dissolve the proceedings of this meeting. I request that we all stand while the stage party leaves the hall, followed by our graduates and our medalists. Congratulations all.
Juvenes dulcimus, gaudeamus musigitur, juvenestum sumus, post secundam juventutem, post molestam senectutem, nos abebitus, nos abebitus, gaudeamus igitur, juvenestum sumus, gaudeamus igitur, juvenestum sumus, post secundam juventutem, post molestam senectutem, nos abebitus, nos abebitus, gaudeamus igitur, juvenestum sumus, gaudeamus igitur, juvenestum sumus, post secundam juventutem, post molestam senectutem, nos abebitus, nos abebitus. Hail to youth and hail to love, hail to life so wonderful. Hail to youth and hail to love, hail to life so